All right. Thank you so much. Well, we want to welcome you to another presentation in our All About Alzheimer's monthly series, and really bi-monthly at this point. So we thank you so much for being here. Again, our goal is to bring you useful information that you can take back with you to your respite and support groups, or those you might be caring for in your family or social support system. As always, it's wonderful to be here with you. I know most of you, if not all of you, already know me, but since we're recording, I'll go ahead and describe or share again that my name is Joan Asseff, and I'm a licensed clinical social worker here in the state of Texas. And I've spent most of my career working with older adults in a wide range of settings, including skilled nursing, hospice, home health, psychiatric care, and private clinical practice. I know how complex your jobs are and how much energy and dedication you bring to the work of serving those who are living with dementia and their families. I now teach a clinical social work practice at the Steve Hicks School of Social Work at Austin, at UT Austin. And I work extensively with students who are in field placements, serving older adults and their care partners and caregivers in the community. So I feel really lucky to have that opportunity. Again, I'm humbled and honored to be here with you today as we problem solve together and think about how we can support those living with Alzheimer's disease and other dementias, along with their caregivers and their families. So with that, we'll go ahead and get started. As always, just a quick note about Alzheimer's Texas. I'm sure all of you know, and many of you know, that Alzheimer's Texas is an independent local nonprofit that used to be known as the Alzheimer's Association, Capital of Texas chapter. They have been a privately funded voluntary health organization since 1982, serving Central Texans with Alzheimer's disease and their caregivers. About 3 or 4 years ago, Alzheimer's Texas broke away to form their own nonprofit and decided to focus 100% of their funds and efforts here in Central Texas. However, Alzheimer's Texas maintains the same level of commitment, providing support, education, and advocacy, much like we're doing today, for those affected by Alzheimer's disease and other dementias within our community. Alzheimer's Texas continues to carry out its vital mission, which is to eliminate Alzheimer's disease and related disorders through the advancement of research and to enhance care and support for individuals, their families, and caregivers. All right, so what are the learning objectives for today? Well, we want to understand the definitions of validation and reminiscence approaches and learn about the potential benefits and limitations of utilizing these approaches for people living with dementia. We want to develop specific validation and reminiscence strategies and techniques to support people living with dementia and their caregivers, and think about and share ways that we can apply and educate others about these strategies. So those are our overall objectives for today. So let's begin with a general definition and description of validation therapy and techniques. This approach was developed over time between approximately 1963 and 1980 by Naomi Fell. I may be pronouncing that incorrectly, so I'm going to say Feel for today. Feel is a social worker who grew up immersed in the care of older adults. Her mother was a social worker, yay, and her father was the administrator of a small nursing facility. So she developed validation strategies from trial and error experiences when working with older adults in this setting. So she was really immersed in work with older adults, really living through the experience of dementia. Validation therapy really provides a method for communicating with those living with dementia. This method of communicating focuses on helping the person living with dementia work through the emotions behind some of the challenging behaviors they sometimes exhibit. And probably many of you are familiar with these challenging behaviors that are often associated with dementia. Challenging behaviors such as yelling or hitting are viewed essentially as the person's attempt to communicate their emotions to other people or with other people. This approach invites the person to work through the emotions behind the behaviors by helping the person feel heard, validated, acknowledged, and respected. This approach focuses on using active listening skills, empathy, and reminiscence, as we'll talk about. As we go over both validation and reminiscence approaches, you will notice there's a good deal of overlap between the two, but for the sake of clarity today in this presentation, I will describe them separately, and you'll notice a lot of similarities. In practice with people living with dementia, these are often used together and interchangeably, just so you're aware. So these are the principles of validation therapy as outlined by Naomi Fiel in her 1993 book, The Validation Breakthrough. She originally referred to the older people she worked with as old. I am using the term older people here to convey respect, of course, and use language more commonly seen in current gerontology research and literature. But I want to make sure that you're aware that she used that term, the old. She sometimes wrote about older people and people experiencing memory loss interchangeably. And I want to be clear that in no way do all older people experience cognitive impairment, as we know, though there is a common experience of some memory challenges for people as part of the normative aging process. I won't go over all of these principles today, but I welcome you to review them, and these slides will be available on the Alzheimer's Texas website. But I want to lift up a few especially important principles, though they're definitely all important. Validation therapy really focuses on the idea that all people are valuable and have worth, no matter how disoriented or confused they are. Validation therapy also posits that there is usually a reason behind challenging behaviors we might see in people experiencing disorientation. For those of us who have worked with and or cared for people living with dementia, we know this is often true, if not almost always true. Whether someone is simply tired and hungry, or if they are remembering something distressing from their childhood, the idea behind validation therapy and validation approaches is that older adults with memory loss try to restore balance in their lives by reliving earlier memories that might be painful or unresolved. If those feelings are allowed to be expressed rather than shut down or redirected, and if they are acknowledged and validated, those painful feelings will likely diminish. And that's really the foundation of this approach. If those feelings are ignored or suppressed, they will likely gain strength and dominate the person's experience, as I'm sure many of you have seen in your work and in your the care that you've provided for loved ones. Underlying this approach is the idea that empathy builds trust, reduces anxiety, and ultimately restores dignity. So how can we apply validation techniques in everyday interactions with someone living with dementia? Well, this example invites us to think about how we might approach a mother, for example, who is living with Alzheimer's disease and often calls out for her own mother. We can first center ourselves, and that's a really important part of this approach, by taking a deep breath, for example, and slowing down as we think about how we're going to react or respond to someone experiencing this type of confusion. Our initial reaction might be to use logic by reminding our mother, in this case, that her mother is no longer living. However, it's important to pause, think, and breathe before we respond. Next, we can ask a question or share something that will invite our mother, in this scenario, to reminisce, such as asking her what her mom was like and what she misses about her. If possible, we might even share a memory about her mother, to invite her to express feelings such as loneliness or other feelings she might be having. We can also use what we refer to as extremes to help elicit larger feelings the person might be struggling to share. For example, we could ask, are you missing your mother a lot lately? Or do you always miss her? What do you miss the most about her? These types of questions can help the person process feelings of grief or other feelings related to missing that person in their lives, or the awareness that they might have about the loss of their mother. It's also important for us to match and express, and in social work we call this mirroring, the emotion of that's being expressed by the person. This matching or mirroring helps to validate the person's expressions and feelings. For example, we can join with our mother in this scenario in her feelings by acknowledging the sadness of missing or losing her mother and the special relationship they had. Rephrasing is also a very useful strategy in the validation toolbox. Rephrasing, or another term that's used is paraphrasing, a person's feelings back to them can provide reassurance that you understand and feel their loss, which is really that expression of empathy. We can also use senses to aid in the validation process by asking a question about her mother in this scenario. For example, we might ask, what was her favorite food that she cooked and how did it smell? What did she like to wear and how did she look when she dressed up to go out somewhere nice? So these are some real concrete strategies that are within the validation framework that really almost anyone, if not anyone, can learn how to use and use pretty easily with folks living with dementia. Here are a couple more examples of how to apply validation approaches in different scenarios. For example, as you see here, an adult child is helping a mother who's been diagnosed with Alzheimer's disease. The mother is convinced someone is throwing away her most precious belongings, including photo albums and scrapbooks. But the mother is actually hiding these things and forgetting that she has done so, which I think many of you are probably familiar with these types of scenarios and how this can happen often with folks who are experiencing confusion or memory loss. A validation strategy would be, instead of arguing with the mother, an adult child could rephrase the situation, helping their mother reminisce about her youth in a positive light. For example, your wedding ring is gone. You think I have stolen it. It was a beautiful ring. How did you and your dad meet? This is a form of redirection away from the distressing thought, while also validating the feelings and the concerns expressed by the person. The second example here involves a physician, which is a common scenario, right? When you're taking someone living with dementia to the physician. So this scenario involves a physician speaking to a woman with Alzheimer's disease in the doctor's office. The patient believes she needs to leave and feed her children, who are grown and no longer live at her home, of course, at this point. A validation strategy here would be for the physician to express the emotional need of the person out loud, thereby affirming the person's right to feel and to express their feelings. You can see the dialogue here where the patient says, "Doctor, I have to feed my children." The doctor responds by saying, "You must have been a good mother. You must miss your children." The patient might follow up by saying, "You know it, and I always cared for them. Whether they wanted, whatever they wanted, I gave it to them. You guessed it. But I get along all right now without them." So I'll also share an example from my own practice experience that's similar to these. I worked for over a year with a woman living with dementia who lived in an assisted living facility, who believed that her blue sweater was constantly being stolen by the assisted living staff members. And of course, we investigated that and found that the sweater was not being stolen. She put her sweater away each evening in a special place to keep it safe, but she didn't remember, where she placed it the next day. And so when she approached me several times a week, distressed about the missing sweater, I often asked her about the history of the sweater and what outfits she liked to wear with the sweater with, what colors did it go best with. This usually helped her calm down and focus her attention on more positive thoughts about this beloved sweater that she really enjoyed wearing. Now, I want to recognize that, the person living with dementia is not always comforted, redirected, or more oriented after a validation strategy is used. Some people living with dementia might continue to experience obsessive thinking about the original stressor or thought, whatever that original stressor or thought might be. It's important to note that validation strategies don't work for all people all of the time. For example, sometimes my client who wanted her sweater simply wanted her sweater and nothing else was going to suffice or comfort her. Um, yeah, she would sometimes not feel at ease by being validated or redirected. And sometimes we simply had to go get that sweater and provide it to her. So I want to be clear that these are not, catch-all strategies that will always work, but they are often helpful and can be very effective in many scenarios. So just to be clear again about the benefits and limitations of this approach for people living with dementia and their caregivers, first, it's important to note that some studies have shown that these validation techniques can reduce depressive and agitation symptoms for folks living with dementia. So that's good news. However, the research is still inconclusive and still ongoing in terms of how effective these strategies are, especially across different types of dementia and in different settings, such as people living at home versus people living in skilled nursing facilities. So there's still a lot of research being conducted, and I want to be real clear about that fact. We know that this approach, again, does not work, as I just mentioned, consistently for everyone living with dementia, and it doesn't work all of the time, even when for someone who normally responds very positively to this approach. It's also potentially less useful in the last stages of dementia or of Alzheimer's disease when someone's communication abilities might be more impaired. More studies across various settings and across various types of dementia are needed, as I mentioned, to better determine the effectiveness of this approach. We know, though, that this approach can reduce the need for medication to address behavioral challenges and changes, which can reduce unwanted side effects experienced by patients and the additional cost associated with these medications. While this approach can be easily applied by caregivers, healthcare professionals, and other helping professionals, it can feel less authentic for some people based on their communication style, values, or beliefs. And I'll share a little bit more about what I mean by that. Some people might feel as if they are engaging with their client or their patient or their loved one around an untruth or potentially something that feels a bit like a lie. I want to be clear that that is not a tenet of validation therapy or validation approaches. Rather, the emphasis is to help validate or to help the person express an emotion that they are feeling by engaging in reminiscence or taking them back to some experience in their life. So while we don't usually in validation therapy negate the confusion or the confused aspect or component of the communication, we're also not furthering it. We're not inviting someone to engage in thought processes around something that's not true. And so I want to be clear that there are some that are less comfortable with validation approaches because they might feel like you're really engaging in an untruth or something that feels like a lie. And that is definitely not a tenet of this approach. All right, so let's shift over and talk a little bit about reminiscence therapy, which again, you're going to hear a lot of overlap and similarities with validation approaches. So, as I mentioned earlier, I am addressing these approaches separately, but they're commonly used simultaneously when supporting people living with dementia. So, reminiscence therapy, also sometimes called life review, many of you might have heard that term used when discussing reminiscence therapy. This approach was founded by a psychiatrist named Robert Butler in 1963 when he published his seminal article on recollection and evaluation of personal memories in later life. Since then, reminiscence therapy has evolved into a talk therapy approach, often used to treat moderate to severe memory loss or dementias. We know that Alzheimer's disease and other dementias absolutely disrupt short-term memory for everyone living with these diagnoses. But research tells us that many long-term memories remain intact for quite some time during the disease process. This approach is built on the fact that these long-term memories are often accessible for people living with dementia. This approach involves the discussion of past events, activities, and experiences, often using tangible prompts and props, such as photographs, household items, and familiar items from the person's past. For example, I love to give you examples from my practice history. I was leading a reminiscence therapy group several years ago at an assisted living when a gentleman that was in the group abruptly got up and walked away. Well, of course, at this point, I thought he must have been pretty bored with my approach or just tired of being in the group and simply wanted to go back to his room and maybe take a nap or rest. However, a few minutes later, he returned to the group with a corn stalk from his family's farm. Apparently, the prompt I had given to the group about childhood memories made him think of this dried up corn stalk he had in his room that he had been holding on to. And he proudly described to the whole group how his father worked in the fields and then how he eventually did the same work when he took over the family farm. Now, as I described in this example, reminiscence strategies can be applied in groups or individually with people living with dementia. These approaches can be more structured, such as a formal life review, which I'll go over in a few moments, or they can be very informal, simply applied while visiting someone casually or even while providing care to someone, potentially during a nursing visit or while a nurse aide is helping someone in their home. So how are these approaches applied? Well, a typical reminiscence therapy session, and it doesn't have to be a formal session, it could just be, the time period in which it's applied. But it really varies in terms of the structure and the intent behind the reminiscence approach. As I mentioned before, reminiscence approaches can be utilized very informally by a nurse or a caregiver while they're assisting a patient with care, or they can be applied quite formally by a mental health professional running a planned reminiscence group with pre-identified participants. Reminiscence work usually involves asking past-oriented questions to trigger memories and promote storytelling. So really, once you see that fluid storytelling happening within a reminiscence group, you're onto something and you're really applying these strategies in an appropriate way. So the storytelling is the work of reminiscence groups. It's also the work of individual reminiscence approaches as well. Examples of reminiscence questions might include, tell me about your parents, where were they born? What memories do you have of them? These strategies can be as simple as a person with dementia being prompted by a caregiver to share something about their spouse or their past career during a walk. Sensory prompts are not necessary, but they're often utilized, including tools the person used in their past. Photographs, of course, are a wonderful tool for reminiscence. Scrapbooks, music is also a really wonderful prompt. I used to play a little bit of, you know, 40s or 50s music to get our reminiscence group thinking about what they wanted to share. I guess now maybe that'll be 60s and 70s music we'll be sharing in our groups as well. Um, Film clips, also sharing clips from old films can be a really good strategy as well. So all of these prompts can help people really think back to their youth or to their adulthood in various parts of their life that they would like to share. Also, old fabric or even toys that are appropriate or aligned with the time period when the person grew up can also be great prompts, and I've used those as well. Reminiscence therapy may also be more structured and complex, again, such as a formal life review, which I'll go over in a few minutes. And it can involve meetings with a actual therapist or counselor, especially for traumatic or more traumatic or distressing past experiences. A mental health professional should be consulted before formal reminiscence strategies are utilized. Now, I want to be clear about that, especially if the person has a known history of trauma. So I keep talking about a life review. So let's take a few moments to talk about what is that. A formal life review is definitely more structured, and it is a more formal form of reminiscence therapy and a more structured way of applying these strategies. It's not only used for people living with dementia, but it's also commonly utilized for people without dementia who are approaching end of life to help them reflect on and recognize their many life accomplishments and resolve or address any unresolved issues within their life course. Life reviews are typically, as I said, very structured around one or more life themes, most often family or childhood, maybe being a parent or aunt or uncle. Sometimes work themes are utilized, holidays, education, major life events, and of course, retirement is also a really great topic to bring into a life review. Life reviews are more likely than less formal reminiscence to be an evaluative process in that participants examine how their memories contribute to the meaning of their life. And they may work on coming to terms with more difficult memories. A life review is more likely to be utilized for therapeutic reasons, to address an unresolved life event. For example, it's often utilized by hospice social workers in their clinical work with patients at the end of life to help them review accomplishments and again, any unresolved life events that they might want to address. The life review process really invites people to examine memories, often in a sequential fashion across the developmental spectrum, though it doesn't have to be implemented that way, but we do often see that where the facilitator or the counselor or even the family member starts off with childhood and then provides prompts over the course of the lifespan. And this is often done in maybe 6 to 8 sessions. So these are not typically not completed in one session or even 2 or 3. And then finally, really, it's just this process invites a more organic sharing of various parts of the life of each individual. But it also provides a structured process for that organic sharing. So that's really the life review. Here are some reminiscence questions commonly utilized to engage people living with dementia. In my career, I have used many of these questions, as I'm sure many of you have. I've used them frequently with patients and clients. Um, Questions such as any nicknames that a person might have or had as a child. Um, Questions like, do you have any special sayings or expressions? These types of questions can really initiate that storytelling that I mentioned earlier in the presentation. And the storytelling is really what we want to facilitate. These types of questions really help people express their unique selves in spite of their memory loss, right? And that really brings a strengths-based approach into the conversation. And they, as I said, cultivate meaningful conversations without creating stress for the person to remember something very specific. One of the great strengths about this approach is that if one question seems challenging for the person living with dementia, you can simply move to a different question that might be more manageable and might feel more validating for them. So it's a very fluid approach that allows the person using it to easily pivot to different topics and plug into a topic that is the most supportive for them in that moment. So again, we want to look at the benefits and the limitations of reminiscence strategies. Many of the benefits and limitations mirror those of validation therapy, partially because these strategies have so much in common. While reminiscence therapy has been found to improve cognition, decrease rates of depression, and improve family and caregiver bonds, this approach, again, does not work consistently for everyone all of the time, as we heard with validation therapy. And it can be less useful in those later stages of dementia where communication is often impaired. While this approach may reduce the need for medication to address behavioral changes and challenges, this approach also involves potentially asking someone to relive unpleasant or painful memories. We don't always know if someone has a painful memory around a certain developmental stage in their life. What might seem like a benign question about someone's career could lead to a painful memory about a coworker who died. For some people we are working with, we can't predict what memories might surface during reminiscence. And so that's important to remember, that we need to be prepared for the fact that something unforeseen in the reminiscence conversation could come up, and that we need to be prepared to support that person, potentially to redirect away or to engage around the painful experience, depending on our level of expertise and comfort doing so, and depending on the severity of that traumatic event, if in fact there is a traumatic or grief experience that someone is reliving or talking about. Of course, the great benefit is that this approach is easily applied by caregivers, healthcare professionals, and other helping professionals, such as those in respite groups and adult daycare programs. Yay, we love those programs. However, it's important to note that, again, research on reminiscence therapy is still ongoing, with some studies showing more impact than others in various settings and with various types of dementia. The important message that I want to leave you with today is, as I begin to wrap up, is that validation and reminiscence strategies must be tailored, as any good intervention, tailored to the person living with dementia. One or both of these strategies might not consistently work for every person, and these strategies will likely need to be updated or revised in terms of how they are applied with each person. So, you may use one strategy for 6 months, and it's really effective with one person. And then as their disease process progresses, you might need to update that approach and to think about new ways of applying these strategies or others. So for those of you who are really intrigued and would like to read more and learn more and do your own research, which I know many of you, if not all of you, do, I have a few resources here to get you started. Naomi Field still directs, as far as I can tell, still directs, in terms of the research I saw, the Validation Training Institute. And here is their website. Their website address they have many guides and helpful videos that describe and show the validation techniques that I described today in practice. And I actually watched some of the videos on the website, and some of them are really good and really help you think about how to navigate through some of the challenges that can come up while using those strategies. And then the Legacy Project is also a great resource for information about reminiscence work with people living with dementia and anyone who might benefit from the life review process. Their website has lists of reminiscence focused questions. In fact, some of the questions you saw here today were from the Legacy Project website. And they also have exercises that can be easily printed out and utilized or saved for various aspects of your work or for your caregiving. And then finally, just kind of an adjacent resource is the Stanford Medicine Letter Project, which has a Dear Friends and Family template for writing a letter about your life to a loved one or to anyone that you might want to write to, which is another wonderful reminiscence strategy for those who are able to write a letter or even dictate a letter to someone else who could type that or write that for them. And so I love having templates and guides, and I'm sure a lot of you do too. So I definitely refer you to that website as well. So with that, we'll close out today and we'll open it up for questions and conversation. And thank you so much for your time and attention today.